With all the technology and research medications that we have today, it's a wonder that people are getting sicker at a younger age. It's a very serious question, and it leads me asking why. And the answer to that question may change the way you think about your health forever. Hey, I'm Rachel. I'm a registered nurse and a functional health coach, and I'm here to teach you today about how to become the CEO of your health. And I've worked in healthcare for the last 15 years in a hospital setting. And what I found was that the same patients were coming back time and time again, but each time they were getting more and more sick. Their health was declining, and overall, they progressively declined as time went by. They were never getting better. And it left the question in my head and in my heart of what is it that we're missing? What is it that we're not asking the correct questions to? It wasn't that these patients weren't getting care or treatment, they were getting all of that, but we were not asking the correct question as to why they had these symptoms and why they weren't getting better. And in functional health, we like to dig deep and ask not just what are these symptoms, but why? Why do we have these symptoms? And what is it, the whole big picture of what's contributing to your chronic disease? So, if you think of it like a health detective, where we put the puzzle together, where there's always a missing piece, right? So there's something that we may be overlooking, whether it be with your diet or your stress levels, or your physical inactivity, certain environmental toxicants that are affecting you. And so we look at the big picture to figure out how we can better help you to have overall better health. And the underlying force of chronic diseases is inflammation. And once you understand that this low grade chronic inflammation contributes to disease, well, then we can do things to better mitigate that chronic inflammation or lessen it. So the problem is doctors only have about 10 to 20 minutes with you when you go to your annual checkup. They see 20 to 30 patients a day, and that leaves very little time for them to go over those lifestyle habits or choices that may be affecting you and contributing to your chronic disease. So, what happens is we end up managing these symptoms with pills, but we're never really solving the problem. So the statistics are quite alarming. 60% of the US population in the United States has a chronic disease, and people are getting sicker at a younger age. And so obesity, cancer, diabetes, heart disease, it's affecting people younger and younger. And so what really needs to happen is it's time for people to take back control of their health and become the CEO of their health. And so, what I'm going to teach you today is 3 steps of how to do that. And how we need to do this, first of all, is become more proactive and not reactive. So, instead of waiting for a diagnosis of one of these chronic diseases and then maybe saying, well, maybe I should look at my life after, we do this before. So we change these habits before we ever get that diagnosis. Not to say that it's never too late. It's never too late to, do something that's going to better your health, but it's just more difficult once the disease process has already set in. So tip number 1 is I want you to ask questions. I want you to ask questions when you go to your appointments. So many people go to their doctor's appointment and they are confused. They are baffled. They don't know what's going on. I hear it time and time again, and you think it would be commonly known, but unfortunately, it's the sad reality. People go to their doctors and they don't ask the correct questions or ask any questions at all. And so what I want you to do is I want you to ask, once you get your diagnoses or your medications, I want you to say, why am I taking this? What is it for? What are the side effects of it? What are some potential interactions with other medications or other over-the-counter supplements or medications, or certain foods that this medication could interact with? And so many people, like I said, they don't know what's going on, and this absolutely has to change. Now, step number 2 goes along with number 1, but you need to keep a health notebook, and I want you to write things down. It's huge. You have to keep track of what's going on with your body. We can't be expected to remember everything all the time. So if you have a notebook where you can write down the diagnoses your doctor's given you, the prescriptions, what they're for, then you will better understand what is happening. And you can also use this to track your symptoms and write down any questions that you may have that come up while you're not at the doctor's office. A lot of times people, they have it in their mind, they're going to ask this, they're going to ask that, and then their mind goes blank as soon as they get in the doctor's office. So this will help you to stay organized and ask those questions that may slip your mind. That way, you don't forget anything and everything is in a nice organized fashion for you. And this also helps you become your own health advocate because it enables you to see patterns that your provider may miss that you can track. And you live in your body all the time. You know your body, or you should know your body. Be intuitive to your body and write these symptoms down. That way we know, are things getting worse? Are they getting better? And maybe how the treatment is going. And then number 3, I want you to do your own research. If you get instructions from your doctor or diagnoses or medication, go home and do your research with a trusted science-backed source. Now, we live in the age of information, and the info is there if you want it. So understanding what's happening in your body will help you to make better choices, because if you understand the why of what's happening, then you're more likely to do things that are going to support your healing. And so I know it can be overwhelming, and there's a lot of noise, opinions, trends, fads out there, but you don't have to figure it out alone. So taking back control of your health doesn't mean that you have to do everything right. We're all on our health journey, right? So you don't have to be perfect. It just means showing up, asking questions, staying curious, and just taking one positive step at a time, and you can make some real change in your health. So if you want some real practical advice and education to help you understand what is happening in your body and more in control of your health, then you're in the right place, because I'll be making videos teaching you steps and tips of how you can better do that. So go ahead and hit the subscribe button and follow along so you don't miss any of these future videos. And in the comments, let me know what's one thing that you can do today to start taking better care of yourself and your health. And then maybe you just have a question about, like, where do I even start? So leave that in the comments. And I'm Rachel, and I'll see you in the next one.